Let's go to Senator Rand Paul on this. Of course, he's quite a fiscal hawk when it comes to such matters, and that generally gets the ire of even some in his party. So it's a good time to ask him about this latest stimulus push. What do you think, Senator? Are you for more stimulus?
Well, we have no money, Neil. There's no rainy day fund. There's no savings account. It's not like we go over to the Federal Reserve, open the safe, and we find, oh, we have all this money we can give to people. The $3 trillion we've already sent to people because of this government mandated depression, it has been borrowed. Where are they going to get another $1 trillion? They're going to borrow it. And so I think it's a really, really rotten thing to do. What you have to do is look at the source. The source of the economic depression is the government and the government shutdown of the economy. The government, and particularly the governors, need to get out of the way, let the economy open up, and let individuals assess their risk and act accordingly.
So when there's talk about extending unemployment benefits, which are very generous on the federal level, or what some of your Republican colleagues have come up with, an incentive to get people to go back to work, you're against both.
Well, if you pay people not to work, they won't work. If you pay people more not to work than they get for working normally, they won't work. It's called institutional unemployment. So right now, the institutional unemployment, if you make less than about $50,000 a year, you've got no business working. Why work if the government will give you a free $50,000? If the Democrats get their way and unemployment goes on for months and months and months, if not years, what will happen is nobody will work for less than $50,000 in this country because you can get that for not working. The Republicans' idea, only slightly less stupid. The Republicans are going to give you a bonus to go back to work, but where are they getting the money? They're going to borrow it from you. They're going to borrow it from your kids. They're going to borrow it from China. It's a ridiculous notion that we just keep passing out money. Let's get rid of the root cause of this depression. Sometimes we don't know exactly the cause of the depression. In this one, we do know the cause, the government. The government shut the economy down. The government needs to get the hell out of the way and let us all go back to work and let each and every one of us assess the risk and make decisions accordingly.
You know, Senator, you're also a doctor, and many school districts and municipalities, including some big ones, Los Angeles and San Diego and Atlanta, are among those saying, we're going to delay the school year because we don't like the spike in cases we're seeing. We think it's risky, so we're going to put it off. How do you feel about that?
Well, you know, the teachers union in California also said they won't go back to work until we defund the police and have Medicare for all. So we have to put this into a bit of perspective. But what I would say is the media have been scaring people to death. The mortality for children 0 to 18 is 1 in a million or less. The mortality between 18 years of age and 45 is about 10 in 100,000. So we need to assess those risks and make decisions. The countries that have opened schools, 22 countries have opened schools in Europe, and they're doing just fine. They haven't had a surge. The other interesting thing is when you do contact tracing in China, the Netherlands, Britain, and in Iceland, what you find is kids not only rarely get this, rarely die from it, but they rarely transmit it. They're just not good transmitters. And in general, people who are asymptomatic are not good transmitters. So the daycare stayed open in New York throughout this for doctors' kids, nurses' kids, hospital janitors' kids, anybody that was associated, firemen, police, the daycare stayed open. Right. And guess what? It had very little coronavirus and very few staff members. About 1% of staff members were infected. And most of these staff members, if they're in a reasonable age group, are at very, very low risk of succumbing to this disease.
Well, you know, actually, that puts you kind of on the same page as Dr. Fauci. I know you two had your disagreements. He is for opening schools in person, but he did say this about, it's an answer to a question about whether he's being slighted by the White House. He said, you can trust respected medical authorities. I believe I'm one of them, so you can trust me. But you need to stick to the data, the science, medical authorities who have a track record of telling the truth. The public can get mixed messages and get confused. What do you think of that?
Well, look, I think Dr. Fauci is well-intentioned. I don't think he's a bad person. I think he wants what's best for the country. But his perspective is that of someone who's always worked for the government and never worked outside of government. So there's a Dr. Scott Atlas, who's a professor at Stanford, as part of the Hoover Institute, who has a much different, I think, much more reasoned perspective. So what we do is we listen to a lot of these people, but ultimately, if we're going to live in a free country, None of these people should get to make a decision for us. For us individually, each individual should assess the risks and make their choices. Frankly, if you're 18 years old, the rules should be, or the advice should be much different than if you're 80 years old. And if you're in a nursing home and you're 85 years old. And so it isn't one size fits all. We can't say, oh, everybody needs to stay at home because someone at the nursing home might get sick. No, let's try to be careful and protect those in the nursing home, but let's open the economy, open the schools. There's a possibility, we don't know this yet, but there's a possibility that this great spike in infections that we're seeing throughout the South, that it may well be enhancing immunity, and it may well be that they reach what I think New York has already reached, a point at which the disease will begin to burn itself out. Interestingly, no one's saying this, but it may not be herd immunity of 60%. It may be a break point for the disease that's much less than that. And there are mathematicians who look at this and they say that the models of herd immunity are based on random behavior and random vaccination. When you get herd immunity from the disease, it's not randomly distributed, and you have some who are very social and some who are less social. But the bottom line is, historically, diseases and viruses have burned out at 25% immunity when you look back at our past. No one knows what the future holds, but I tend to be optimistic that we might get to 25% immunity, and the disease may be, we may be maybe able to overcome the disease at that point.
Very quickly, we'll be talking to the mayor of Miami. And now it's Miami Beach that has already put out a proviso, no short-term rentals here, fearing that the thing is worsening. It's different from Miami, I grant you. But do you think that is an overreaction?
I think we don't know until we see the death rate. I think that infection rate and testing are complicated, whether things are going up or down. I do believe they are going up, and people are infected. Even in my town here, Bowling Green, Kentucky, we meet people every day who are infected, and to a person, they're all getting better. They're getting mild disease and getting better. So if this is a mild disease in Miami, don't shut it down. If you have an increase in your death rate and it's significant, maybe you should. But so far, Florida's doing way better than New York. You wouldn't know that if you watch CNN, but Florida's doing way better than New York. New York had a disaster, a public policy disaster, public health disaster in their nursing homes due to Democrat Governor Cuomo's decisions. Florida's doing a lot better, but you won't get that from the media that has become so biased and cannot report any of this objectively. It's a disaster.
Senator Rand Paul, thank you very much. I believe the senator is referring to total cases, total hospitalizations, total deaths.